If you've noticed, you just try to look at a dog's mouth and look at the teeth without doing anything, they won't be still. And they're going to be moving all over the place. And when using an instrument inside the mouth, you're going to have problems.
A good oral exam needs to cover the lips, the tongue, the mouth, and even the throat, the tonsil area, the pharynx area. And you just can't get a good oral exam on a pet that's awake.
This is Blackie. He's a 4-year-old domestic short-hair cat, and he's here today for a dental cleaning. As you can see, he's missing both his eyes, but it still makes him a very sweet kitty. We do a full physical exam on them before they go under anesthesia in order to ensure that they don't have any medical problems that could complicate the procedure.
And typically, after we've done a good physical exam and done a standard database of blood work, we can pretty much tell you which pets are higher risk and which pets aren't. The anesthetic protocols we have nowadays are very, very safe.
What the veterinarian does under anesthesia is use sharp instruments that will go underneath the gum line to remove the bacteria, the plaque, the tartar that's accumulated below the gum line, and it allows us to work then and put antibiotics or bone augmenting products below the gum line to try to replace some of that bone.
So anesthesia is important just to get the pet diagnosed and see what you have going on, let alone trying to treat.
The little rat terrier was presented for some disease around his lower incisors. So we anesthetized the dog, we cleaned the teeth, and then I x-rayed the lower incisors, and we noted on x-ray that there was no bone holding those central 4 incisors in. And then as I was cleaning the teeth, we also noted 2 teeth that were a bit mobile in the back part of the mouth that could not be determined by a wake oral exam. And so upon x-ray of those, then we noticed that there was no bone around those either due to periodontal disease. So I was able to extract those 2 teeth, plus the 4 incisors in the front, finish the cleaning, and then applied Oravet, and now we're waking the dog up. Most animals do develop periodontal disease as a result of the plaque and calculus that builds up on the teeth.
The bacteria in the mouth can be transferred to the liver, to the kidneys, and it can affect their overall well-being. So what's important about dentistry is getting those pets in for an exam first of all, and then under anesthesia so that a proper exam and diagnostics can be performed.
We are messing around in their mouths quite a bit, and especially in the cases of when they need extractions, it can be very painful. And so without anesthesia, I don't think it's a very humane thing to do.
But home care is the important thing as far as prevention goes. And if we would get into the mindset of preventive dentistry like we do in humans, then it would be a whole lot less risky for the animal. Anesthesia time would be minimal. The amount of work that you would have to do would be minimal. Traditionally, it's been waited till an animal is very advanced periodontal disease before they have treatment done because everyone is so afraid of anesthesia. But in reality, that's making the problem worse because then there's more of anesthetic risk when you do that.